So, hi everyone, and very warm welcome to this webinar, which will focus on a Nordic perspective on digitalization and the importance of interoperability when serving the citizens. And my name is also Zetterberg, and I'm the Managing Director at Swedish IT and Telecom Industries, IT&Telekomföretagen, which is a member organization for companies of all sizes within the entire IT, telecom and tech sector. And we are happy to have almost 1,400 member companies. Our mission is to create the best possible conditions for a world-class tech sector in Sweden. It is also our mission to drive and facilitate the digitalization of Sweden. And we do this by ensuring it is a priority issue on the political agenda, but also by clearly demonstrating the benefits of and supporting the use of digital products and services in both the public and private sector. Also, we want to play a role for a greater sharing of experiences. And today's webinar focuses on sharing experiences and to be inspired of our Nordic fellow colleagues. We have so much to learn from each other, and we and also as the citizens up here in the north, we have so much to gain of a society that offers more and better use of data and digital solutions. Also, we have great opportunities to be in the very forefront globally when it comes to digital welfare services. Within health tech, ed tech, gov tech, and so on, we can grow our export, and the tech companies can grow their companies, and by that create more jobs and more value. And of course, we can support a better quality of life for more people. So thank you all for being with us today. And now I will hand over to my colleague, the best Lars Lundberg, who will be your guide during this session. Hi, Lars.
Hi, Åsa, and thank you for those words. Well, since we have a tight program that focus on interoperability this morning in the Nordics, so let's get started. I'm going to very shortly introduce four speakers, and it's Ulrika from Roche, and then we have Mick from Digitaliseringsstyrelsen in Denmark, and then we have Ville from NIIS and Bengt Andersson from Nordic Welfare Centre. These are the guys that are going to give you a journey into what interoperability and digitalization really means. So Ulrika, now it's your turn to say some words about the market.
Yes, thank you, Lars. And thank you for this interesting day and this seminar. And just before we have the example from our colleagues here in the countries, I just need to reflect what actually has happened during Corona. And of course, just having the name Roche on my my name, it is also something that is important to draw the learning what actually happened during Corona. So what happened then behind the scene? I mean, we were facing a pandemic. We as Roche, we were producing a lot of tests. We have never ever seen the exposure of the demand in such a speed that we had today. So, but what happened and what make a whole thing working in not only in a Swedish perspective, but in a global perspective. So we could see before we could see that we had struggling with legislation. We could not get our test out on the market, but during Corona, we all of a sudden, the process of getting approval, the legislation of getting everything done and approval, all of a sudden changed from years of time that we had before we got a test accepted on the market. All of a sudden, we had the approval within a couple of months. And that, for me, it's actually something that could prove that we can change and we can adopt, and we can scale much faster than we have done before. So that's it's a learning from our perspective, but also it's a learning that we also empower the people and our inhabitants, that we could have digitalization as a support within healthcare, within welfare, within the education sector. Everything got digitalized over a day. Everything, everyone, and all the companies and all the inhabitants were all of a sudden more exposed to digitalization than ever before. And this, for me at least, this was a learning. So how can we ride on this to make it even more successful in the future? And going back to what I said before, having very, rigid and heavy process of getting acceptance of medicines or tests or everything, that when the legislation was very, rigid, meaning that it took so long time to get everything accepted and rolled out on the global market, all of a sudden we could have this in a couple of months. So it is possible. It is actually possible to make this happen. And I think we need to ride on the way that we started and that we have created on not only a local market, but on the global market. And as a company, if I take that perspective, I think it's also very, very important for us to learn from each other, to mean that we can learn what kind of solution that works in Norway, in Bergen, for example, that can also easily adopt and make accessible for a small village in Skåne or in Finland. So how can we share? How can we scale faster? How can we fail faster? And how can we actually lay the foundation for the faster implementation and scaling of welfare technology? For me, it is very easy. We need to have a Nordic functional market. We need to learn from each other. We need to easy access the really good example that we can have developed in one country and share it with the other country. So it is the importance and the momentum is now to make this happen. But on the other hand, we need to also look into the hygiene factors to make this happen. So for me, it is very, very important that we work more with interoperability and also where we open standards and have the faster scaling of the solution. So we need to have future-proof standardization and the interoperability to make this happen. And I think I will not talk more, but I will hand over to our colleagues in Denmark. So I will let the scene to Mick, who will give you some examples on what's happening in Denmark.
Thank you, Ulrika. I hope I go through. I think so. Thanks a lot for inviting me to this interesting seminar, or webinar it is. I will, in short, introduce you to some to a Danish context on digitization and get into more detail on our work with the digital welfare. First, I'll talk about the context, as I said, mainly about our joint public cooperation with municipalities and regions. And after that, I'll give you a few examples. Ulrika, you can Ulrika, I think it's Nicole. Please, next slide. First, a bit on the Danish context, because it's pretty important to know and be aware of in order to understand our work on public digitization. Since the last structural reform in Denmark in 2007, we've had 5 regions, approximately same size. One is a little less than the other, a little smaller than the other. and 98 municipalities. And as we state on the right-hand side of this slide, there is they got different tasks. Looking at the state, it's what we know: defense, universities, police, and so on and so forth. And the regions mainly focusing on hospitals and psychiatry. I think that claim around 90% of the regional expenditures. And then we have the municipalities working on what we call citizen-oriented tasks, elder care, child care, also a bit into health, and also a slight difference between regions and municipalities is that municipalities do fund themselves by 75% local taxes and around 25% state subsidies, while regions are totally funded by state taxes. Let's go on, because I'd like to talk more into detail about the public cooperation on digitization. Because in Denmark, and this is key to the development that we've seen, there was an early consensus, a political consensus, that digitization is a means to create a better and more efficient public sector. And a large part of our agendas with digitization presupposes strong cooperation between these three entities: states, regions, and municipalities. We've had around 20 years of very close cooperation between the three parts, and have over the years had quite a lot of good results. Now it's me talking, but I think that's also broader recognized. Just to mention a few, we introduced digital post more than 10 years ago, and today more than 90% of the citizens above the age of 15 are signed up and uses digital post on an almost daily basis. Another one is Borger.dk. I think its translation into English will be some citizen.dk, which is a personalized website where citizens can access data on themselves on a number of personal subjects. For instance, tax issues, daycare, and different kinds of payments and subsidies from the state. Last year, this website had almost 60 million visits, and that's quite a lot in a country with 5.8 million inhabitants. What we've also experienced over the years is that the latest strategy is a bit challenged, because it was agreed back in 2015, and normally we make these agreements for 5-year periods of time. And in 2015, honestly, we did not know much about, or we did not know what we do now. So one of these experiences that we have taken with us is that we do not have to plan so specifically far into the future. There must be some room to learn on the way and to adjust the strategies that we initially agreed. So that is what we are actually working on right now, because we will agree a new common strategy this year, later on. We hope in spring, and it will last over the next 5-year period. And And we plan to build into that strategy that we plan some of the activities that will take place in the first couple of years, and then we'll be open to adjust the strategy over the next 5-year period. The backbone of the strategies is the annual budget agreements that the states agree with municipalities and regions every June, and in the agreements we agree on planning, development, implementation, and also funding of new activities to put into place. The funding is also a bit is worth mentioning. 40% of the funding comes from state, 40% from municipalities, and 20% from the regions. But this is an important context to be aware of, as I said earlier, and to understand the work that we do overall in Denmark when it comes to digitization. Nicole, please, next slide, because then I'll go into a bit more detail on our work on digital welfare. We faced, as you have done in your own countries, probably some changing conditions for the welfare states. A growing elderly population and more citizens with chronic diseases to follow. That raised also an increased demand for individual services, also individual digital services. And the development has also fostered a demand to look into possibilities of utilizing technological opportunities to support and supplement what we used to see as human tasks. The next slide presents a few numbers on this topic. Because we have asked the population, is welfare technology a good solution to secure support, care, and self-help? And what the figures show is that for the people that have been using welfare technologies, actually 91% agree to some degree or another that welfare technology is an obvious option, while the same numbers for those who have not been using digital welfare technologies is 82%. But all in all, I think our conclusion is that that Danes do welcome welfare technology, especially when we have personal experiences. So that's a good place to start. To move on to a couple of examples, I've brought a few. What have we achieved? When it comes to telemedicine, the regions, municipalities have for 3 years, it's now 4 years back, worked to disseminate telemedical wound assessment at the national level. The case is that diabetic patients often develop food ulcers when they have been ill for quite a long time, and this is a growing challenge since the number of people diagnosed with diabetes in Denmark has more than doubled from 2000 to 2016. The purpose of the implementation of telemedicine wound assessment at national level is primarily to free up time in both municipalities and regions for other important tasks, but also to try and streamline and improve the quality of the treatment. So how does it work? specialists in the hospital, they spend their time to assess the wounds digitally, while the health personnel in the municipalities, they take care of the actual wound treatment, and both in elder care homes or in the patient's homes. That was one example. Another one, which is a bit newer. It's a case on tele-COPD. Tele-COPD stands for chronic obstructive pulmonary disease, and that was also a national dissemination that was agreed at the annual budget agreements for 2016, and the case is that it enables citizens with COPD to measure their relevant values in their own homes and forward data to a municipal healthcare professional, who then monitors and the development of the state of their disease. The results are proving. They show. I'll come back to that a little later in the call. The results are proving, and they show that quality of life decreases less than among the citizens who receive the telemedicine treatment than among those who doesn't. And it's also proven perspectives as regards possibilities to develop a more generic telemedicine infrastructure. For instance, this infrastructure is also able to connect other patient groups faster to relevant care in municipalities or regions, cheaper and more effective. For instance, we are now trying to see if it's feasible for patients also experiencing heart failure. Moving on to the last slide, very brief, because among our visions for the future, we 2 years ago decided, in agreement with regions and the municipalities, to place 200 million Danish crowns in an investment fund, because we experienced a lack of experience with the use of AI in the public sector, and we want to see what can we do, and agreed to put in place the so-called signature projects. And these projects, they must test AI in areas where there is a potential to increase quality and productivity in the public sector, in its core tasks. And until now, we focus on 4 selected areas: health sector, social employment, climate change, and then this focus on cross-sectorial handling of cases. Currently, we have 28 projects running. I don't have time to get into detail on the specific ones, but some prove good results, and at the moment we're working on gathering preliminary experiences from the cases in order to look into possibilities of scaling some of the projects and of course closing some others. I think that was my words for now. Moving on to the next one.
But before that, Mick, very shortly, briefly, you mentioned that you had within the health sector a kind of national digital infrastructure. Could you just say some words or around that?
Yeah. Over the last many years, we have built on our a digital infrastructure in healthcare, and it's Medcom, MED, CUM, who are in charge of running and developing on standardization issues, we're still facing problems about full interoperability between the 5 regions. Inside regions, we have a perfect infrastructure. Of course, development is always needed, but between regions, we still face problems. And also between the regional level and the primary healthcare sectors, the personal doctors, we do see some problems. I think other ones will come into standardization issues, and it's definitely and that's the way forward also on that issue.
Yeah. So thank you for that, Mick. And now we go further to Ville, that will go deeper into standardization and interoperability. So Ville, please.
Hello, good morning. My name is Ville Sirviö and I'm the CEO of NIIS, the Nordic Institute for Interoperability Solutions. Thank you for this opportunity to be presenting NIIS and our work on interoperability today. So NIIS has its roots in the year 2013 when the prime ministers of Estonia and Finland agreed on collaboration around interoperability. And that was in particular collaboration on Xroad data exchange layer technology. In 2015 already, Finland and Estonia started collaborating on Xroad and developing the software for national interoperability together. The development was still made in 2 different teams, which was a bit complicated. So it resulted in a shared organization, which is NIIS, and this organization was established in 2017. In 2018, we started developing Xroad, so it was brought actually under the shared development. And at the same year, we also got Iceland to become our partner in this collaboration. And in the next year, also the Faroe Islands was joining this group. So we are now having a total of 4 countries working on Xroad. And what is Xroad? It's an open source software and ecosystem solution which is enabling national interoperability. So it is a software which is used as a national data exchange layer by the governments, but it can also be implemented within regions, within different organizations. So it is not only limited to the national use. And the basic idea of Xroad is that the members of an ecosystem can exchange data through their access points, which are technically security servers. And the idea is that once the organization has connected to the ecosystem, it doesn't have to integrate again. So through one access point, it is possible to communicate with all services in the ecosystem. So it means saving time and money for actually developing citizen services. And Xroad is a digital public good. It was recently verified by the Digital Public Goods Alliance. It's released under the MIT open source license. So any country willing to implement it can do it. It's free for anyone to use. And this is illustrating the Xroad ecosystem. So the idea is that we have the security servers of service consumer and provider organizations, and we have Xroad central services. So it is still a centrally managed system, but it's fully distributed by its nature. So it's also very secure. It cannot be taken down easily by any attacks or anything because all of the security servers communicate individually with other security servers. And it is not centralized by any means, but it's fully a decentralized system. And Xroad also takes care of trust services. It includes logging of the messaging, timestamping of the messages, certificates of the message exchanging parties. So it is a secure data exchange solution. And Xroad also has a built-in feature for federating Xroad ecosystems. So Xroad ecosystems can be connected with each other. So in example, Estonia and Finland have their ecosystems federated, and it makes it possible also within healthcare solutions to immediately connect different citizen services with each other. So any service in Estonia could be called from the Finnish ecosystem directly and vice versa. So there is no technical difference in calling services from other countries once the services are connected in one Xroad ecosystem. Next slide, please. And yeah, this is just to illustrate that we also have Xroad community. It's now a community of around 1,000 people from over 60 countries who are working on the technology and participating in community events on Xroad. And if we look to the next slide, we can see a map from around the world, countries including NIIS members on blue, and then NIIS partner countries. We see the purple ones, which are countries with Xroad implemented, either by a national data exchange layer implementation or as a private implementation. Just to name an example, in Japan, Giers has Xroad in their use. In Germany, we have a medical prescription solution based on Xroad. You can actually find a case story about it in NIIS website and Xroad website, actually xroad.global. And in the xroad.global website, we also have some other case stories about Xroad implementations. As you can maybe notice, in the South America, we can see plenty of Xroad implementations. And the most recent case story we published is from the province of Neuquén in Argentina, which now has Xroad as their regional data exchange layer. We also have plenty of companies working on Xroad around the world, so it's possible to find still support and help in implementation and connecting services. Even though Xroad is open source, we still have full support available. So this is just to demonstrate our official partners working on this free open source technology. Our product vision for Xroad is to make it more modular, to fit better for different countries' needs, to keep it easy to use and make it even easier, to make it cloud native, keep it secure and safe, and we also aim to make it a sustainable data exchange solution. We are currently working with the Stockholm Environment Institute in a project where we assess the Xroad security server's sustainability aspects like its energy consumption and other aspects regarding sustainability. We are also reporting about this work during spring and probably will do a few postings about how we are progressing, but we have an ambitious goal of making Xroad also the most sustainable data exchange solution in the world. And let us see how we will succeed, but at least we'll try as much as we can. And it's really an interesting journey around sustainability. Okay, but to have a look to Finland, we also have to have a look to Estonia first. And the reason is that Finland and Estonia have been working together on Xroad, implementing the national data exchange layer similarly, but not fully similarly. So let's take a look into Estonia and how they have implemented the eHealth architecture. I'm not going too much into technical details, but I will just pick a few details which are worth highlighting. So in Estonia, they have a national data exchange layer, which is enabling once only principle to its full extent. So Xroad in Estonia includes all services of the society from all sectors and from all actors of the society. So in the middle, we can see Xroad and the ID solutions and others forming certain layer, which is connecting all of the services for citizens and for organizations technically. And it includes even the ambulance services, emergency service, mobile workstations, it includes police, it includes border guards. So everything in Estonia is running upon Xroad. And this is the reason why we can also see Xroad integrating the public healthcare. And I think what is important here is to understand how the healthcare is changing. Now when e-health is a more and more increasingly popular topic, we see that it's not only about the health information systems, which are usually still in focus when we talk about e-health. But actually what is important is to remember the life around it. So all of the e-health services should be well connected with the rest of the national infrastructure to be able to build, in example, live event-based services for citizens. It means that we have to have a full availability of all of the services of society. So in my opinion, the once only principle is one example of what is important when we talk about the future e-health. And the integration layer is an important factor there. But let's next take a look into Finland. So we here see quite a similar image, and if we try to find out what is different, in the middle we have, and sorry this is in Finnish, but I translate to my best. So in the middle we also have Suomi.fi data exchange layer, Suomi.fi palveluväylä in Finnish, We have several other services, including Kanta, which I will say a few words after this. But the difference with Estonia is that Finland has several different integration layer items. It has different services, it has different integration solutions. It's a bit more of a complex picture compared to Estonia when it comes to only the data interoperability in the middle. But still the fundamentals are somewhat the same if we look into the future. Having Xroad included in the middle means that Finland has the technical capability of building up a system based on once only principle, a system capable of making services based on live events for citizens. But let's take a further look into Kanta. Kanta services are citizen services and also backend services for the Finnish healthcare system, enabling the maintenance of, in example, electronic patient data. It includes browsing own medical records and prescriptions, so it has new citizen services for that. It includes electronic prescriptions for the citizens, sharing of medical certificates and a pharmaceutical database. So Kanta is connecting all of the different actors in the healthcare system, including the patient itself, including hospitals, healthcare and social service providers, pharmacies and so on. So this is one of the essential elements besides other systems and solutions for national interoperability in Finland. So hopefully my presentation gave you an overview of what's going on, and if I should summarize with one message, the future e-health interoperability is much more than e-health information systems. It's about how we connect all services of the society, how we implement live event-based services, and how we make the societies interoperable. Thank you.
Thank you for that, Ville, and you have already answered these questions. So we go further in the presentation, and Bengt, welcome to do your presentation.
Thank you. Yes, my name is Bengt Andersson and I work as a senior advisor at the Nordic Welfare Centre. And thank you IT&Telekomföretagen for arranging this webinar and inviting me as a presenter on it. Next slide, please. A little bit short about Nordic Welfare Centre. We have four focus areas: welfare policy, disability issues, integration and public health. And I work in the area of welfare policy, senior advisor in welfare technology, as I more often say, digital transformation in the area of public sector. And we work for the Nordic Council of Ministers that have a secretariat in Denmark, in Copenhagen. Just a little bit short about Nordic Welfare Centre. We can take the next slide. I will foremost talk about healthcare and care through distance spanning solutions. That is a priority project going on from 2018 to 2020. I can take the next slide. It's a so-called priority project. And what is a priority project? It's cross-sectoral. It goes over several areas of several ministers, Council of Ministers in our collaboration in the Nordic Council of Ministers. It's a focus on rural areas or sparsely populated areas, and you can read more about this at healthcareatdistance.com. And you can take the next slide. The project consists of three main blocks. We have done a mapping of distance spanning solutions applied in the Nordic municipalities and regions. We also identified tools to support the implementation of distance spanning technologies in the Nordic municipalities and regions. And the third last block we're working on right now is through calls identifying Nordic municipalities and regions to provide support in the implementation of distance spanning solutions. You can take the next slide. And I will focus on the first block here. I could just say that on the second block in identifying tools to support implementation, we have found that the Nordic Welfare Technology Program, Norwegian Welfare Technology Program, they have developed their tool for roadmap for service innovation. And we have translated this roadmap for service innovation to all Nordic languages because we think this is the most successful tool when implementing doing the digital transformation, foremost in municipalities, but could also be used in regions. And what they in block 3 are doing, they are testing this using this roadmap for service innovation in the projects that's ongoing. Next slide, please. And we did a publication that came 2020 in January with the 24 most interesting solutions, and we had these 4 categories. And I would really like to say about these 24 most interesting solutions is that we started up with mapping in each and every country, and we were starting with around 200-300 solutions. But the main criteria here is that we don't want to have any pilot project or project at all. These 24 most interesting solutions as presented in this publication, they are in place. They are no project at all. They are given as a service to the citizens in these regions and these municipalities. We're so fed up with all these projects and pilot projects. We need to present what's working and what is there. We can have the next slide, please. You can download the report from this code. Yeah, I can take the next one. So I'm going to give you a couple of examples, and you will probably recognize all this, but these are something that are very common around all Nordic countries right now, using safety alarm that are mobile. We have in Sweden, I think 260 safety alarms, security alarms that work in your home, in your flat, in your house. But if you go outside, they don't work. So this is a mobile alarm with GPS technologies. And I think it's a quote from a Norwegian user that is very good. He said that just a day without a tour or a day without a walk is a bad day. But when he used this kind of technology, he could go out, and this is very important when it comes to prevented public health. We can take the next slide. Digital night monitoring with cameras. We have night patrols driving around, just checking up. I think around 40% of the visits they are doing during nighttime, just to see that people are sleeping in their bed. So this is something that is offered with different kind of technologies and been very successful as we see it, and is widely spread in several of our Nordic countries. We can go on to the next one. Electronic and automatic medicine dispensers. This is another solution that's been really a rocket the last years. There is people that have a lot of social service help, but of course also home care in healthcare, just to take the medicine in right time. If you have 2 or 3 chronic diseases, you eat a lot of medicine. To take your medicine, the right medicine at the right time, what these solutions support you with. I know that in Finland, where this is very often used, it's also often used with forced video visits, just to make sure that you really take your medicine at the right time. Yeah, next one. This has already been mentioned by Mick. This is telemedicine solution for citizens with COPD. This has been going on for several years, and I think it's rolled out now as a solution for all citizens offered to all citizens with COPD in Denmark. It started up in North Jutland, and now in all Denmark and working with this. And of course, there are results from Aalborg University showing that this is really efficient out of all perspective, not foremost absolutely for the citizens. Yeah, we can take the next one. What we see, and then I go back to Norway, this is one response service platforms is one of the 24 solutions you can see in the publication we did. And what they see there in their welfare technology program, that the municipalities that have implemented the 8 welfare technology solutions that they all aim for by 2020, that all Norwegian municipalities should have implemented. We can take, for example, the Agder region in southwest of Norway with, I think, 25 municipalities. They have all implemented the 8 solutions that they see that when we have a lot of people getting all these very good welfare technology solutions, they generate a lot of data. And do we need all that data when it comes to social service documentation or to the EPR healthcare journals? Do we need all these data? Maybe we just need 5 or 10% of that. But what do we do with all the data that is generated? This is just something we at this project had done this illustration just to see, could it go into an individual hub? Could it go back to the citizen, being a support in their prevented public health life? And how does this work? Because when we want to go to an integrated healthcare and social care system, we really need an interoperability between the healthcare data and also the social service data. When it comes to elderly people with several chronic diseases that get support both from healthcare personnel but also from social services, these must be more integrated. And we can see that this is a bottleneck when we want to implement more of these distance spanning solutions, these welfare services, that we need to work with this in a focus of integrated healthcare and social care. And we could complicate this a little bit more by, you can take the next slide, by seeing what can wearables do. We can take the next slide. We did mapping last year just to see some of the examples I've given you when it comes to localizations, technologies, digital night monitoring, or telemedicine solution for citizens with COPD. Could we use mainstream wearables like Apple Watch or Fitbit Sense or Garmin Watch? What can they do? So we did a mapping of what they can do, and we see that they can really take a part. But then again, how do we put in this in the illustration that I showed you just before this slide? How can we make that work in interoperability, and what can we safely go through to our documentation that we need in healthcare and social services? There's a lot of question, but I think this somewhat could be the future. All right, I think that was the last slide I had, Lars. Yes, and right in time as well.
Thank you, Bengt. And just before this question, which Nordic country has come the furthest in the terms of interoperability from what you have seen? That's I say this. Why I work in the. I just want to say that why do I work in the Nordic cooperation? I think we need to exchange experience and so on. But I could also see it as a competition between our countries. And I think it's a dead race here between four of the countries. I can see that we heard about Ville explaining what they're doing in Finland with Kanta and integrating also the social service part of it. Mick talked about Denmark, and I summarized that somehow. Mick, correct me if I'm wrong, that you go by digital first. We have Sirviö in Iceland that is very similar to Kanta. And I talked a little about the the Norwegian welfare program, how they are working. But so between these four countries, they are coming very far, I think. In it comes that there is a lot of things to do still. But I think Sweden will be just second behind all the four of these countries, because I don't think that we have worked enough strategic to do it in this way. So that's my answer to that question. Thank you for that, Bengt. I think you're a little bit humble because you said the four of the other Nordics are at the same level. But next time I will give you some stress to really say which is the number one.
Yeah, so but Sweden was second.
Yeah. So let's go to the final discussion then. Going to our speakers, what do you say? What can Sweden learn from Denmark and Finland? And from what you heard from Bengt, Sweden is the second in place, and the other four is number one. So let's start with you, Bengt. We're going backwards.
Yeah, I think we can learn a lot about from exactly what we heard from Ville and from Mick here, working with what go on. And I think it's impressive to see what they've been doing in Finland. I think it's to follow what you're doing with Kanta and how you can integrate. For me, from my perspective, it's very important to integrate healthcare data and also social care data, because if you go down to a personal citizen level, we need to see it from a bottom-up level, not from the top down. I can see what a lot of things we're doing also in the other countries are top-down perspective, but we have to go back to the citizens and see it out from their perspective. And I think what Finland doing with working with Kanta is something we really want to follow and see how they can do that.
Okay, thank you for that. And Ville, what do you think we Swedes can learn from you and from Denmark?
Yeah, I think all of the Nordic countries can learn from each others. And talking about the Nordic countries, I would never forget following what is Iceland doing, what are the Faroe Islands doing. So even smaller of the Nordic countries have been performing surprisingly well in certain areas. I think all of the countries should learn more about collaboration. I think one of the biggest challenges in Europe is what I think Bengt was also pointing to, the competition and the situation how countries are building things separately. So there always has to be a certain built-in here aspect in starting something new. And it applies even to Europe as a whole. When the governments talk about open source software, it usually means that they start building new open source software, but actually we have plenty of software available just to implement it. But more important than the solutions is the collaboration and platforms for collaboration. So yes, that's what we need more.
Thank you for that, Ville. And going to Mick.
Thank you. First and foremost, I think we can learn quite a lot from each other, and I think close cooperation also between the 4-6 countries will be a possible way forward. What can Sweden learn from Denmark? I think what we have done with quite a lot of success over the years, I hope that was also clear from my presentation, is this very, very close cooperation between states, regions and municipalities, because that has been key to the development, that we have not forced each other to do anything, but agreed to a common path forward. And we have built a lot of the infrastructure together between these 3 entities. And I think that's a clear strength from the Danish side. And then I think we do in Denmark face quite a lot of also legacy problems, and some of the other countries, Finland maybe the most, do have started at another level and building some software or build their infrastructure, not with all these legacy problems as part of their history. So that is one of the things that challenges us in Denmark still.
That's great. Thank you, Mick. Ulrika, if you are there, what do you think we could learn?
No, I think it's very. I mean, we have really good examples today presented from our neighbors. I think all of us has touched upon it. We need to work together. We need to build up a well-functional ecosystem, meaning that we need to be in the shoes of our citizens. Meaning, what is the purpose why we are doing this kind of services? So we need to be in the shoes of the citizen and try in a collaborative way, and also focus on the interoperability, so we can share among not only the country, but actually also between the regions and between the municipalities in our country. And going back to what Finland is now doing and what Estonia is doing and the other countries, I mean, we need to realize that in Sweden we do this kind of patchwork, we lappar and lagar what we try to when we try to do the development. And speaking of experience in my previous role in another company, it's hard to kind of sometimes it's easy to just, start from the beginning and then start the building. But we have a legacy that we need to take care of. But I am hopeful, and I think that actually that if we are having the same perspective that we need to collaborate, that no one of us could do the whole thing by ourselves, but we need to build up this ecosystem, learning from what Denmark does, but also learning together with the public sector to create together and have this perspective that sharing is caring. Then I think we could actually make a faster speed to what we want to do for the citizens and the inhabitants.
Thank you, Ulrika. That was good conclusions. And finally, I would say that we within the IT&Telekomföretagen, we are always working with taking care of the possibilities that digitalization gives. And today I think we have seen that Sweden and the rest of the Nordics have to form a kind of task force to learn from each other, to find the kind of platform where we can share our learnings in order not to invent similar things everywhere. So I think kind of learning foundation for sharing knowledge could be something good. That's what you are saying. But I also think what you are doing in Denmark is great, that you are also working with 5-year plans where your finance department are giving you money on a yearly basis for 5 years ahead, and you are forming programs for that. And I think that is a good thing, because then you are working on a long term, not as we do in Sweden, just plotting out money now and then. So I think it was really good to hear you and have you together sharing what goes on in the Nordics. And as you know, we at IT&Telekomföretagen, we always want to be at the forefront, as Åsa mentioned in the beginning. So there will be some really good webinars even further on. So all the slides that you have seen, they are now shared in the chat. So you can download them and so on. And if you have questions, you can see the presenters' mail addresses, so you can contact them as well. And also, don't forget to look at IT&Telekomföretagen's homepage, where we always have our upcoming webinars. So thank you for participating today. It was great. And I look forward to do a lot of digital things together with you. So thanks a lot, and yeah, goodbye.